A very good morning to all of you. We have come to the day 2 of the International Health Conference of Bioinquirer 2014, Trauma and Emergency Care. So I warmly welcome you once again to day 2 of the conference. Before I start, I would like to kindly request something from the audience. Please be kind enough to switch off your mobile phones. If you want to answer a call, please go out of the auditorium and answer the call because we had many disturbances yesterday. Thank you. To start today's conference, I cordially invite Mr. Tim Morse from Coventry University, UK, to do the keynote address.
Good morning. Thank you very much for asking me to deliver this shorter talk, I hope. When I was sort of thinking about what I was going to say this morning, I thought it would be certainly an opportunity to think about what we did yesterday and to think about really looking at the fact that we are actually picking out some sort of global standards relating to managing trauma and indeed emergency care. So what I wanted to sort of pose to you really, and this is certainly to more so to the nurses and students out there, is that have you ever thought that within Sri Lanka, how you might be able to change emergency care delivery, or indeed care generally? Is there anything that you could have done or can do to evoke change? Now, whatever your career pathway is intended, we've all got a common goal, and that common goal is looking after our patients and either promoting their health or indeed promoting them to a comfortable death, perhaps. So, in terms of trauma care and emergency care, what can you do to change it? Just to have a think, perhaps, as to what you could, how could you influence things? Have you ever dreamed of changing something? Well, we all know that working in healthcare is about caring, funnily enough, and one of the problems that we experienced in the United Kingdom in 2005-2009 was that it was noticed by various audit organisations that the number of patients within Mid Staffordshire Hospital, there was an unexpected number of deaths. The number of deaths seemed to be increasing. So there's an investigation. And the investigation actually showed up the fact that it was to do with staffing levels was probably one of the key features. The other main feature, though, was the changing in attitude because of the stress and the difficulties the nurses were finding working in an environment that was particularly understaffed. Everyone's got a role to play in the healthcare system, and everybody's role is there to safeguard the quality of patient care. And it was clear there were areas within the delivery of that care where there seemed to be some void or some lack of care delivery. In fact, one of the things that has developed from this is how we recruit nurses for the future. And certainly within the UK now, we're not only looking at potential student nurses who are qualified and have the required qualifications, but also that they demonstrate quite early on that they do actually have a caring attitude towards patients. And that's quite hard to tease out when you're interviewing people. So what happened as a result of the inquiry came this report, which was done by Dr. Francis, and hence the Francis report. The Francis report finally was published in February 2013, so quite a recent publication, but it highlighted a couple of things. The first thing it highlighted was around the element of care. So the Department of Health in England launched something that we call the 6 C's. So what are the 6 C's? Well, we'll talk about that in just a couple of moments. The intention of these 6 C's, and indeed the Francis report, was to actually have a fresh look at delivering future care. How can we deliver future care that's high quality, indeed caring, but within the financial constraints that the world seems to be facing? And in fact, the issue around caring actually now works from top down, and certainly in terms of accountability, the managers now have accountability whereby if for some reason there is any changes in staffing, they're being short, or indeed the death rate, which goes as unexpected, then they are held account to answer now, and indeed can be dismissed because of it. So it's affected everybody. So what are these 6 C's then? Well, 6 C's published by the Department of Health, our National Health Service, are care, compassion, competence, communication, courage, and commitment. But what are these? What does it mean when we're trying to change and reintroduce the culture of compassionate care? Well, care is your core business. It's my core business. That's what we're here for. That's what we're here for in terms of all of our organisations. The care that we deliver has got to help somebody. It's got to assist them to either to get better, or indeed, eventually, maybe death. It should improve the community health. Okay, so we should be concerned about promoting health across all communities and making sure that everybody benefits. And the people receiving the care should expect it to be consistent. The care that they receive in the north of the country should be the same care that they receive in the south. And it should be consistent throughout their life as well. So it shouldn't be just focusing on one particular age group. It should be consistent throughout, whoever you are or wherever you are. Then there's this issue of compassion. What's compassion? Well, compassion is how care is actually given, and it's through different relationships, and it is based on empathy. It is based on offering respect and also maintaining the individual's dignity. Dignity not just for the patient, but their families and carers too. Now, it's also described, and so the Department of Health describe it, as intelligent kindness. And that's to do with how people perceive their care. So the attitudes of how you respond to when people visit a ward, for example. And there are occasions where I've gone onto a ward and I've been totally ignored. Nobody said good morning or good afternoon, and that needs to come back. What about competence, though? Because we need to measure and maintain competence. Okay, so we do need to make sure that all of those within a caring role have the ability to understand the individual's health needs and social needs and know how to deliver it. So they have to be competent practitioners. So it is about expertise. It is about having both clinical and technical knowledge, but also making sure that the care we deliver is based on the best evidence, not based on this is how we've always done it. Communication, and in fact, within the UK, the Nursing and Midwifery Council now say one of the biggest reasons as to why nurses struck off the nurse register, it's because of poor communication either between nurses and other healthcare workers or between nurses and patients. And that's concerning because the number of inquiries from the Nursing and Midwifery Council against nurses has quadrupled in the last 5 years. There's a significant number of investigations now against nurses for whatever reason. So it's central, isn't it, to what we do. We need it for good team working. When we're going to work as a team, we've all got to communicate together. Listening, clearly, is important as to what we either say or what we do. So as well as asking people or talking to people, we've got to listen to people as well. We've got to listen to our patients, what they want. I think it's essential that we have this phrase, no decision about me without me. In other words, if I'm going to be involved in a decision, then I need to offer my opinion. I need to speak up. It's key, isn't it, to a good workplace, making sure that if we all communicate, we all know what we're doing, it does help with morale within the teams. And it helps you as staff. What about courage? This is to do with if you feel strongly enough about something that you actually stand up and speak out as to what you believe. Not only about concerns, but also about the things that are good as well. It's doing the right thing for people. And that's to do with your own personal strengths. Possibly having a vision as to how we're going to innovate and embrace different ways of working. How can we do things differently that might make things a little easier, but actually benefit everybody? We've got to be committed. I do know a number of nurses where they'll turn up for work, for shift, and they go home at the end of that shift. And if I was to ask, for example, do you mind staying just a few minutes longer because we're really busy, but tomorrow you can go off early, they would insist on leaving on the dot, whatever they were doing. And it is about being committed to our patients and the populations within which we work. We need to build on our commitment to improve not only care, but to improve the experience as well. Okay, we want to treat them as we would treat our families. We need to take action, and we're going to need to make this vision. We need to turn it into a reality. So if we've got any other challenges ahead, we can actually tackle them and face them and sort of develop what we may seek for our future. But they've missed a trick. Department of Health published those 6 C's. Should it be 7? It's a dream, perhaps, to have that 7th one, 7th C. What could it be? The important thing for me, I think, is striving forward to develop a dedicated and high-quality service. That's what we want. That's what we all want. Collaboration is the 7th C, missing there. It's collaborating not only with each other, but also across the world, grasping global standards that work. It's about working in partnership and sharing experiences. So let's bring it back now to trauma and emergency care. Suggest that you only settle for the best. That can only be the standard. We need to seek global standards, and we saw that yesterday through us all singing, really, from the same hymn sheet. Wherever we came from as a country, we were all talking about the same way of either assessing or managing problems. The Department of Health said that they intend to have the right staff, so with the right people for the job, with the right skills, in the right place. But obviously at the right time as well. Got to be there when they're needed. And that is certainly something that again changed across the UK by now offering 24-hour investigation support. Certainly a number of years ago they used to say, sorry, you can't have your x-ray tonight because there's nobody working, come back tomorrow. That doesn't happen anymore. It's 24-hour, 7 days a week. It's always possible, though. Well, let's just think about the International Institute of Health Sciences. And these are indeed some of my opinions and beliefs. The Institute's grown, in my mind, incredibly. It's been a huge growth in such a short time. An awful lot has been achieved. They've become affiliated with many, many organisations, many to which I didn't appreciate. So, what is collaboration then? Well, it's to succeed through reaching out with common objectives. And we've all got common goals. So it is about sharing ideas and having that common deep determination that we can all achieve. We all can actually do this. So who's collaboration for? Well, it's for you. It's for your patients. It's for your families. The future's with you. Thank you very much.
Thank you, Mr. Tim. So let's enjoy